Hello, good morning to you.
No, not yet.
Hello, good morning to you. And hello, good morning to Mr. Sabri and his daughter. It gives me a lot of pleasure to share my experience of the very successful heart transplant which we did on Mr. Sabri. First of all, it was a very organized team effort, and Mr. Sabri himself was a very ideal patient for a heart transplant. Although he had a failed heart, he was very cheerful, very optimistic, and he was very, like, at no point of time he was afraid or he was less motivated or something. He was always well motivated and he was in very good shape. So we had a very ideal patient, and we took it from there. And we had a proper team of the OT, like operation theater surgeons and operation theater surgical assistant, nurses, technicians, and everybody, including perfusionists. Plus, we also had a proper, well-trained intensive care unit team, which include the staff nurses, physiotherapists, and everybody. So only with this backing, we could confidently enter into this surgery. And first of all, he had a prosthetic valve. For that, he needed to be anticoagulated. Because of the anticoagulation, we always knew that there is going to be an increased risk of bleeding. So we were always thinking one step ahead. At no point of time we let the disease dictate the terms to us. We chose to be one step ahead in a very proactive manner. We anticipated what are all the ways things could go wrong, and we tried to rectify it even before they could happen. This was the strategy which has worked out. So even in the intraoperative period, after the patient was anesthetized, we had put him on a transesophageal echocardiography probe, and we were continuously monitoring what was his left ventricle contraction and what was his pulmonary artery pressures, volume status, and everything. This we did both in the native heart and as well as in the transplanted heart. And after the patient came off bypass, we gave all the required blood products, and we kept the patient on a proper hemodynamic state so that he doesn't bleed excessively also. At the same time, his vital organ perfusions and everything also will be well maintained. And immediately after surgery, we were continuously doing the echoes. Like, we were initially planning to put a pulmonary artery catheter, but the patient had very good hemodynamics, so that we just thought, okay, we are not going to get any extra information from that, so we declined because it might add to the infection also. So we did not put a pulmonary artery catheter, but to make up for that, we were doing echo on every alternate hour basis. We were seeing the heart function, we were seeing the stroke volume, and we were seeing the LV size and everything, and we were continuously monitoring the blood pressures also, blood pressure, urine output, and everything. So by the continuous monitoring, we came to a conclusion that in about 6 to 7 hours after surgery, we thought, like, this patient is having good consciousness, good muscle power and everything, and he could be extubated. After extubation, within the next 48 hours, the patient's drains and everything were removed, and the patient was ambulated. And the entire credit for the early ambulation should go to our intensive care team, which includes the physiotherapist and the sisters, and they took good care of the patient. And immediately, within a few hours after extubation, this patient started having his black coffee and his light breakfast and everything. So he also showed the inclination to get the energy and get back on his feet. So all these were very motivating for us also to accelerate. Yes, we had one or two small hiccups, but we found out the problems at a very early stage itself. And just for example, there was a drug which probably gave some small hepatocellular damage, and we immediately stopped the medicine, and we reversed it within the next 3 or 4 days, so that he became completely normal, and he could be moved out of the CT isolation room within 7 days after his heart transplant. So after he moved out of the isolation also, we made it a point that all our consultants will at least go and visit the patient on a 4th hourly basis to see what is happening, and we gave round the clock coverage for the patient through the sisters team and also through the physiotherapist team also. So doing all these things, the patient, he could be ambulated, and he could be he could be accommodated back into your normal preoperative routine. So, so everything was done, and now we are having Mr. Sabri, who is out of the hospital within 15 days of his heart transplant, and now he is doing quite well. And I thank everybody for the cooperation and the expertise.
Okay, Dr. Kalyan Raman actually has participated in more than 18 heart, lung or heart and lung transplants. And when this patient came, the only question was how to bridge him and how to stop the anticoagulation. So when we are discussing about reducing the dose of drug and coming down, everyone said that there could be a clot, coming and can occlude. And I and Kalyan, we discussed and said that because he has got a paravalvar leak, even if the valve clots, nothing will happen to him. That confidence we had. So I thank Dr. Kalyan for taking good care of him. And I wish Mr. Sabri a very, very happy and uneventful recovery and future life when he goes back to Morocco. And his daughter is going back to France, so she will be very peaceful and happy and without worries. Thank you so much.
Thank you, Doctor.
Okay.